Hi everyone, thanks for joining. We're going to get started now. Just a reminder, we have approximately 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Yaffe here, so I'll turn it over to them to get started.
Good afternoon, and welcome back after a sunny, warm, long weekend, Victoria Day weekend. And we hope everybody had a enjoyable long weekend, but more importantly, had a safe long weekend. And as always, when we have these long weekends, we look for some impacts of those. Hopefully, if everybody did as they're supposed to do while they're outside, we will not see in 7 to 10 days some impacts of this with increased cases. But before we go to there, let's go over to Dr. Yaffe to talk about what we did see over the weekend as far as some of our numbers and data and points of concern that shows you how we did do. And then we're going to be looking down the road to see how are we going to do and what we should expect. So over to you, Dr. Yaffe.
Thanks very much, and good afternoon, everyone. Hope everyone was able to get outside and have a safe and enjoyable long weekend. I am pleased to report that since the last provincial update last Thursday, Ontario's daily case count has remained below 2,000 cases per day and has been gradually going down. Day after day, this breakdown goes to 1,890 cases on Friday, 1,794 cases on Saturday, 1,691 cases on Sunday, 1,446 cases yesterday, and today, 1,039 cases. This is incredibly encouraging, and we have not seen these daily numbers since early March. These latest numbers bring our 7-day average down by 26% over last week when we had 1,693 daily cases as an average. Unfortunately, we are reporting an additional 103 deaths since Friday, and that includes 33 today. As always, we extend our deepest sympathies to the families, friends, and caregivers of those who have passed away from COVID-19 and to everyone mourning the death of a loved one. We continue to see improvements in the number of hospitalizations and ICU admissions. Today, there are 1,025 people in hospital with COVID-19. That's up from 983 on Monday, but significantly down from 1 week ago where we had 1,484 people in hospital. There are also 692 people in ICU, and that is up from 687 yesterday, but down from 764 last week. These trends remain encouraging, but the numbers are still high, and they represent people who are very ill from this disease. Our testing volumes have been quite low over the last 2 days, with 20,151 tests processed Sunday and 16,857 processed Monday. The positivity rates were similar at 6.4% and 6.2% respectively. This is a metric that has been trending steadily downward in recent weeks, and our current 7-day average for percent positivity is 5.7%, down from 6.7% last week. I'm also reporting a total of 16 cases of thrombotic thrombocytopenia, or TTS, linked to the Provincial Astrazeneca vaccine. Of these 16, 13 now meet the criteria for VIT, or vaccine-induced immune thrombotic thrombocytopenia. Unfortunately, I must report that we now in Ontario have our first death associated with VIT. This individual was a male in his 40s, and he received a first dose of the Astrazeneca vaccine toward the end of April, and unfortunately passed away a few weeks later. While the investigation is ongoing and a final cause of death has yet to be officially determined, it has been confirmed that the individual did have VIT at the time of his death. Again, the risks associated with this vaccine are rare, but they are real, and I want to extend my deepest and heartfelt sympathies to the family and friends of this individual. In the wake of this tragic death, I know that many individuals who received the Astrazeneca vaccine as their first dose may be feeling uneasy or concerned about their own health and safety. I want to take this opportunity to reiterate that those who received AstraZeneca vaccine should feel very confident in their decision. But of course, if you have any questions or concerns, do not hesitate to reach out to your healthcare provider. The improving trends that we are seeing are because of the public health measures are in place and because of the progress that has been made in vaccinating Ontarians. The decision to get vaccinated is the best thing to do to protect yourself, the people you love, and to protect the whole community. If you've already been vaccinated or if you're planning to be, thank you. To those who may still feel hesitant, please don't be afraid to ask questions. Reach out and talk to a healthcare professional if you want more information and to have your concerns addressed. I'd now like to turn it back over to Dr. Williams for some additional remarks. Thank you.
Thank you, Dr. Yaffe. I'd like to also express my condolences to the loved ones of the individuals who passed away from COVID-19, 33 alone reported today. And, of course, the one individual who passed away who died with VITT. Our thoughts are with those members of the family or in these difficult and challenging times, and we're seeing more and more in that younger age group, those under the age of 70, and some of the younger ones even under the age of 40. So we are concerned as we continue to see the impacts of these variants in our populations. But at the same time, as Dr. Yaffe's alluded to, with our vaccinations increasing down to younger and younger age groups, we're closing that off as quickly as we can and noting that our rates of testing is dropping as well, and our percent positivity, which is a week ago we were up in the 7s, with the same weekend dip, we're now in the low 6s. So these are all important. We've given over 8.2 million doses of vaccine, and we're heading up, trying to get closer to that 65% first dose coverage level in there, and starting to do some second dosing as well. So our first task always was to get as many people as possible, and we want those who are thinking about it to make sure you go forward and get your first dose of the vaccine. And we say that you should go as soon as you get your appointment, whether that's the Pfizer or the Moderna, knowing those are the ones we're offering right now for first dose. And we understand that some people may recognize the name Pfizer more than Moderna because we've had a lot more volume of that. But both are mRNA vaccines. Both have the same level of efficacy or effectiveness, I should say, as in there. And they're both deemed to be safe and of good performance as far as that is concerned. So we don't want anyone turning down the opportunities to get vaccinated when that comes. Now we have everyone 18 and above, and we're starting to move into the youth and that with the 12 to 17s as we start to ramp that up in the early part of January or June even more to try and get our coverage up as high as we can in there to get that level, driving these number of cases down, getting close to getting below 1,000. But we always have this little dip in the weekend, over a long weekend, with fewer tests being done. We want to see if this is some direction that we can continue into the early part of this next week in there and keeping our percent positivities down as we hope to drive this below next week, below 1,000 on a regular basis of new cases coming forth at this time. So we want everyone to get vaccinated as soon as you can when your name comes up. As I said, we've started some areas where we're doing second dose, especially with the AstraZeneca, and some of the ones that were one of our first ones vaccinated way back in March, who are now past the 10-week period in there. And we're going to be giving you updates on that as soon as we have all that data and information available for you. So get vaccinated. But importantly, as Dr. Yaffe said, while that vaccine is taking effect, while we're going through getting all those ones done, the public health measures are still critically important. That while you're out and doing more things outside, still stick to the household. Still watch the distancing, the masking. Remember the formula, 2 out of the 3. If you're outside, you either have to distance or mask. One or the other. You can't say go outside and do neither. You have to do both, one or the other. And same with your other contacts. We've opened up some things in there. If you're going to be doing those activities, do them safely. We wanted to make sure the pre-activity and the post-activity, if it's congruent in group activities, we do not want to see that. We've heard some events over the weekend. That is what we did not want to see, and that's disturbing, especially now. Some of them are in the younger age group who could have been spend that time getting vaccinated, and we have those opportunities open for you. So book and get seen and get vaccinated and get protected in that. So we're winning Ontarians. We're doing a great job. Our ICU numbers are coming down. We're well below 700 at the moment. Some of those are the ones, about the 10 cases or so, that have been, we've offered to help with Manitoba by bringing some into the northern part of Ontario where we don't have cases, and also in the Ottawa area, which is also very low. We're doing our part to help others as well because they helped us, and we want to help them in their time of need. So Ontario is showing that sense of delivering on getting vaccinated, being careful, being cautious, taking our steps down slowly and going down lower and lower to get into those levels where we can open up. We want to be down there first and to get our hospitals emptied out, to give a break for our healthcare workers. And also, if we can help others in that time of need. So thank you for what you're doing, what you will be doing as we go forward the next few weeks ahead of time as we head into the month of June. So thank you, and with that, I'm going to hand over to media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
And the RAF, CHCH TV.
Yeah, hi, doctors. I'd like to ask about the Astrazeneca vaccine. So that people understand out there, what is the difference in efficacy between getting it at 10 weeks and waiting until 12 weeks? And what should people do? Why should they go and get it at 10 weeks if there's going to be less efficacy?
Well, thank you for the question. And we were concerned about how this is to be communicated. When the company did their initial studies, they did it in 4-week periods. And so they had 4 to 8 and 8 to 12. And in there, they noted that after 12 weeks or after, they found over time the effectiveness of the vaccine accrued and got even better. And so those who waited until 12 weeks or more had the main benefit. The differences that we said between 8 and 12 is an average over a 4-week period, and we are saying with the time period between 10 and 12, is it that much different? And the answer is probably not that much. And what we're seeing now with some new data from the UK is that people will get 2 doses. As it goes on even longer past the time they got the 2 doses, their immunity keeps getting stronger and stronger, approaching some of that of equal to the mRNA vaccines. So this is a lifetime knowledge base hand in there, and sure, can some people get it after 4 weeks and 8 weeks? Yes, I guess they could. We just want them to get the best level of protection they can, and so it's not that it's a hazard to get it earlier. It's just that the data we have is that it may not be as beneficial. The actual difference between 10 and 12 is not that large, and so we're saying that's okay. We would still like those who could wait for 12 weeks. We wouldn't mind you waiting for 12. We know there are some vaccine that's available now that we'd like to utilize, and therefore we're going to use our areas that started way back with our first pilot studies with our first initial projects in the Kingston, Windsor, and Toronto area, and they have now surpassed that 10-week period. So we're going to try and get those ones done, and then the others as they get past that 10-week period in different cohorts moving through. And then we'd ideally still like to say, if you could wait for 12, because we want you to get the best effect and the best value out of having the 2 doses of the Astrazeneca when your time comes available. So I hope that helps the answer, Randy.
Follow-up?
Okay, we've seen the new cases down to almost 1,000 today. You said last week, I believe, that you wanted to see cases down below 1,000 before we started to reopen. How much of a factor is the new cases versus the percentage of people vaccinated in the province when it comes to going into the reopening?
Well, our first metric we want to make sure we're tied to is our vaccination rates. So we first want to be beyond a certain level. And we want to be above 60% coverage throughout the province, not just some areas versus others. So we still have some that in some parts of the province are under 60%. We also want to make sure that those other metrics, such as number of cases, as we said, we want to be well below 1,000. I want to be closer to 550, 600 per day. That works out to a certain amount per 100,000 per week. And we want to make sure that our hospitalizations are coming down. We understand the ICUs. That's from a health system standpoint, we want those down as much as possible, knowing that that's complicated by the transfers and repatriation of patients around out of the regular beds into the ICU. So that number is not as dynamic as the hospitalizations, and we're seeing that those numbers are ebbing down as well. So there's a number of metrics that play in there to say that are we down and we're going to stay down and progressively drop down through the whole summer rather than going on a roller coaster. So vaccinations are important. Other metrics are also important, and they're all moving in a good direction at this time.
Next question.
Rob Ferguson, Toronto Star.
Hi, Doctor. I'm just wondering, now that we've got this target from you of 550 to 600 cases a day, how long does it need to be at that level before you think it's safe to move on easing restrictions? And I remember last summer you said you wanted to get cases down to about 150 or 200 so that health units had enough people to do proper, thorough contact tracing. So do they have the resources to contact trace at this level?
So thank you for that question, Rob. When we get down to these levels, we've been asked that we would stay at a certain time to allow us to assess. And even when you get down to 60% coverage, some people just got the vaccine yesterday, so they haven't built up their immunity for another 2 or 3 weeks. So we want to allow that period of time to watch that, as well as to watch we're not getting any new introductions of other variants in there, because we want to steadily go down and stay down in there. Last summer when we were at that level, we didn't have any vaccinations. So we weren't too confident on how people would have multiple contacts and how to follow that. We're finding now the good point is that with our case contact management, even at some of our higher numbers, they find that a lot of people have been in contact with people vaccinated. So the scope or the circle of contacts is starting to reduce and come down to more workable levels at that time. So we're watching to see how our health units are feeling their ability and capacity to do that. Plus, the other thing we have that we didn't have last summer is that we didn't have our central case contact management resource that's available to all the health units, that we were trying to get 100 or 200 hired there. We have now well over 1,000 that are available. So we have much more capacity in the province to assist as well. So it's a different system than it was last summer.
Follow up.
Okay, thank you, Doctor. And switching to the second doses of Astrazeneca, I've been hearing from leaders and people on Twitter and whatnot. They were trying to book AstraZeneca appointments over the weekend and just being totally frustrated, finding that the place where they got their first shot isn't getting any more AstraZeneca, and there's not a list out yet for pharmacies that they can contact and so there seems to be a bit of a mad scramble going on. What can you do to correct that?
So, yes, we understand that, and we are concerned with how that might work out. We know that our initial group of the Covishield who got it back in the early part of March for that 2 or 3 week period were only located in the areas of Kingston, Windsor, and Toronto. So we're trying to utilize pharmacies in those areas to bring the AstraZeneca that we're trying to utilize before the end of the month and to make that available for the 10 to 12 week period. Those are a number of things that have to come together correctly. That means the provision of the vaccine to those pharmacies in those areas. The people who were asking for appointments, were they in that initial the initial period of the Covishield vaccine, yes or no? Their pharmacists would know in there. And then we now have another 254,000 doses of AstraZeneca. We hope to roll out to a wider area, seeking to try and see, because this vaccine, the 254,000, does not have an expiry date at the end of May. If we can utilize that and try and encourage those who seek to have the booking time, if we can encourage them to try and wait till 12 weeks, again, to the previous question, trying to get the maximum benefit for them so that they would have the best protection they could have in there, but they could start doing that. So I understand there's a bit of confusion there, and they're going to have to work hard with their pharmacists to get an explanation and to get their booking time, because it depends on three things: when they got the first one, when they're coming up to 10 weeks for that initial group in those three areas, when they're in the 12 weeks in the other areas, and also to ask the question of the pharmacists when they have the vaccine in their store or in their pharmacy ready for it. So those are four metrics that have to come together, and we're trying to move on this as quick as possible. The good point is that we have lots of people who are looking eager to get their second dose, and even that's whether it's mRNA vaccine that they're waiting to. We're going to try and see how soon we can move on that. If we can max out our first dose and people keep signing up, 18 above keep signing up. We're starting to do the 12 to 17s. So we're really trying to get that percent up well above 65 to 70. I'd like it above 75% if we could. We'd be one of the leaders in that. So I think Ontarians can do that. So we were trying to do two or three things at the same time. So I apologize for a bit of confusion. Talk to your healthcare provider, talk to your pharmacist to understand where you are in that queue and when you can get booked, and be patient and try and call again in there. Because remember, the pharmacists are using a different system than the COVAX system. They have their own booking system.
Next question.
Colin DeMello, CTV News.
Hi, good afternoon, Dr. Williams. I'm asking about the back-to-school plan. Obviously, next week, this time next week is the 1st of June, so the clock is ticking. I'm wondering if you or the Ministry of Education has come to a final decision, or at least can you give us a timeline for when that decision is going to be made and announced?
Well, thank you, Colin. You know, my position is that I've been encouraging schools to open as soon as possible. Discussion with our medical officers of health throughout the province. All of them want the schools open. We're some in the most affected areas, like Peel and Toronto, are working hard as their numbers are coming down quite assertively and looking encouragingly on that. As for the decision when that's going to be, that really is in a decision that has to be made up at the cabinet level, and so we're waiting to hear if and when that decision will be considered in that. And so I haven't had a definite date given to me. In there, we know that the next week will be the start. 31st of May into the first week of June would be an opportune time for some areas, and we may want to do things on a regional basis because there's a variation still within the province, with some areas of the province having now very low case numbers day over day, while some are still having, while they're a lot better than they were a few weeks ago, they're still above 100 per 100,000. So we're trying to watch that carefully and to bring that under control. So lots of discussions, and we hope to hear some answers soon in that matter.
Follow up.
All right. Thank you. And several other provinces, Quebec, Manitoba, British Columbia, already are looking at shorter intervals for the second dose for just the general population, while obviously prioritizing elderly and medically vulnerable people for second shots. I'm wondering where Ontario stands on this currently, because the Ministry of Health seems to be indicating that they're waiting for a recommendation from NACI, but it's my understanding that Ontario could make that decision to shorten the interval between doses on its own. So what is the holdup, and at what point are you thinking that we can actually shorten the doses from that the 16-week interval?
Dr. Yaffe's been always on the Federal Provincial Territorial Committee. She may have some comment to make on that, and I'll have some follow-up comments. Okay? None? Okay. The situation is that, as you know, with the mRNA vaccine, unlike the Astrazeneca, where waiting until 12 weeks post-vaccination as compared to the minimal time of 4 weeks post-vaccination for the second dose, there is actually proven benefit of waiting in there. The mRNA vaccine passed the 21 and 28 days, respectively, Pfizer and Moderna. The benefit of waiting longer for receiving the second dose is not as evidence-based and not as strongly recommended by the producers and the manufacturers. The reason we delayed the second dose across the country, and with NACI's recommendation, it was felt to be more important to get as many people with first dose, because the coverage with the first dose of Moderna and Pfizer is really very effective, close to 80% and certainly 100% nearly, against severe consequences such as death and hospitalization in most of the people. In the very elderly and those with a lot of comorbidities, that's not true, and that's why we went ahead and did the 2 doses in our long-term care residents and our retirement home residents in that. And so as we go through, going forward with the task force, as we assess that we can make sure we get as many first doses done, we will be considering whether we want to start shortening that and starting to move into our queue with a second dose, because we'd like that, start to move on that one assertively as well. We know there's lots of people out there that are waiting to go. Thank you for being patient and waiting. If we can do you sooner, we will, but we don't want to do people with a second dose when we have people queuing up still waiting for their first dose. So we're trying to do a fine balancing act here. What we don't want is a whole bunch of vaccines sitting in fridges going nowhere. And we want those in the arms of people. And we're now getting a lot more Pfizer vaccine this coming week, with close to nearly 1 million doses per week arriving. So that's really encouraging. And we hope to make strides in that. We've had some good numbers this last week, nearly getting close to 200,000 doses in one day. So the teams out there, the mass centers, the primary care, the pharmacists, everybody's pulling it hard, and people are booking and coming forward. So thank you, Ontario. Keep coming out. Keep being patient. We want to get you done, first dose, and then we want your second dose. So keep in mind, we want it done as soon as we can, and we'll let you know on that.
Last question.
Farah Murali, CBC News.
Hi, Dr. Williams. I just want to follow up to Colin's question there on the schools. You kind of deferred to Cabinet on when they would make a decision. But as the Chief Medical Health Officer, when would you think it's actually safe to open schools? We're seeing large numbers of young people, particularly here in Toronto, getting vaccinated. If we get down to these case numbers of 550 to 1,000, which you've talked about, and given that, we're accelerating vaccinations, more than 60% of Ontarians have already gotten their first dose, is there a chance that schools will, in fact, reopen before the end of June?
Well, my position has been always, like our public health measures table and our medical officers of health, that feel the schools should be the last to close and the first to open. So ideally, I'd like the schools open before we enter step one of our exit strategy. In there, the number of cases coming down means that our large health units like Peel and Toronto are feeling more assured that they can do the case contact management. Our schools were safe before we closed down in the rapid rise of the third wave. At that time, we got overwhelmed and we couldn't guarantee the ongoing safety. Now, most of the medical officers of health in the province of Ontario, including those in the GTA, feel that they are pretty well ready to move on that as soon as possible, because they understand the need for the students to be back in for many reasons, and the value of in-class attendance in there, as well as we're going to be working at the ongoing vaccination of the 12 to 17-year-olds, and hopefully utilizing sometimes school opening as a benefit in there. So we're confident that we can be supportive of making sure the schools are as safe for everyone, including students and teachers and other staff working there. And the other thing that's different than when we closed before is that now we've dropped our age down. Not only that students are getting vaccinated, but now the parents of the students, even down to JK age, many of them have been vaccinated, will be vaccinated. And if you haven't, we hope to get out there fairly soon, because everyone 18 and over is eligible with a booking to get vaccinated. So it's a different setting. And so we feel that we're prepared to do that when there's been the proper decision with all the aspects I said before. You need everyone coming together to say, yes, we're ready to move on that. Including parents feel confident, staff and teachers, and as well as boards of education, ministry, and MOHs. So we're all coming together on that one, so we hope to be able to have a decision soon.
Follow up, and this is the last question.
And just picking up on what you're saying about the large number of young people 12 plus getting vaccinated, I know that the reopening plan that was unveiled last week really focuses on the vaccination rates of adults 18 plus, even though those age 12 plus are now getting vaccinated quickly. Given the number of people or young kids that are getting vaccinated, will the province factor those numbers in when it decides to reopening, and could that actually allow things to reopen more quickly ahead of this June 14th proposed week date?
Well, it'll be a factor, but you have to remember when the youth, especially if we're starting this week doing some, when we really ramp it up in the next week or two, they like the adults need 2 to 3 weeks to start to build up a good immune response. It doesn't happen instantaneously. So while I would be I'm more assured that they're going to do it, and some will mount some even quicker, like in 10 days or so, because they have much more vibrant immune systems. I'm really looking for that kind of protection as we go into the summertime to a lot of activities, especially as we're looking at things around day camps and ideas or concepts around overnight camps and things like that we would like to consider. And more importantly, that they can get their second dose in the summer so that when the fall, they can enter into a much more different setting than they did in leaving in the June. So we'll consider it, but it's just ramping up now. We need some time for them to build up their own immune systems to get the maximum effect out of the mRNA vaccine, which is about 2 to 3 weeks from now.
Thanks, everyone.